San Pedro Sula, Honduras, home to more than 500,000 people. Like any country, they have their rich and poor. But here, the rich live behind walls and fences for protection, and the poor live in their shadow. Metal shacks with dirt floors are home for thousands of people. The only place they can go for help is the public hospital, where patients overflow into the halls and supplies and doctors are limited. But help is here.
All of these people here started lining up at 7 o'clock this morning. All of these patients have actually been pre-screened. The hallways, they're hot, they're dark, but everybody's cramming in here because they want to see the doctors. All of these people here, a lot of them have young children. They're here to see Dr. Alvear. He's right behind that door back there. Now, some of these kids have been waiting on these operations for years, and Dr. Alvear is here to make it happen.
We've seen a lot of rare malformations in children that some folks will never see in their lifetime. You can see their faces, and that's all that matters.
Dr. Domingo Alvear, a pediatric surgeon at Harrisburg Hospital, founded the World Surgical Foundation 15 years ago. Doctors and nurses volunteer their time to do free operations all over the world. Their most recent stop, Honduras.
We have 5 rooms, 5 ORs, plastic surgery, general surgery, laparoscopic surgery, neurosurgery. They're all seeing patients right now.
Dr. Paul Kunkel, a general surgeon from Holy Spirit Hospital, seeing patients living in pain with gallstones.
If you came into America with those symptoms, you'd get your gallbladder out that day or the next day. Here, they can't do that. The operating rooms are too full. They don't have the personnel to do it, so they get put on antibiotics, they get sent home, and they have to live with their symptoms for years.
Dr. David Lever, a plastic surgeon from Harrisburg, has been to Honduras 6 times.
Hard work, but the people are so grateful for everything we do that makes us want to come back.
3-year-old Salvador was born with a cleft lip. Dr. Lever fixed it on a previous trip.
Gracias.
It gives me the goosebumps, really. It's just nice to see them.
1-year-old Ruth, full of smiles and giggles, waits to see Dr. Lever. She is too young to understand the pain her mom feels when people stare at her little girl for being different.
They're somewhat ostracized here. They don't do quite as well in school and in public.
But that is about to change.
We're going to repair her lip tomorrow.
Really happy to come here because they are really poor.
Mid-state doctors bringing hope and new beginnings. Tomorrow we'll be taking you inside the operating room. You can see what Ruth looks like after her surgery. We'll also be taking you inside the emergency room at the hospital, the most shocking part of our trip. For ABC 27 News, I'm Kendra Nichols. Operation Day in Honduras. The rooms are ready, tools lined up, gloves are on, and the patients are waiting. It can be scary for a little boy. Lots of tubes, machines, and masks. But a reassuring touch will help him be brave. Dr. Alvear is ready for his first surgery of the day. A boy born with a gap in his intestine.
And so you can see that they're not connected.
After this surgery, the little boy will be allowed to go to school.
So he'll be a normal person.
Carlos and Ruth will be getting new smiles today. Dr. Lever changes their tiny faces. Each cut and stitch means no more stares.
Yeah, now we're starting to close. This is the muscle that allows you to kiss. This is to reconnect it so he can pucker up.
All better and back in Mom's arms.
Muchas gracias.
But the doctors can't help everyone. Right now we're in the emergency room at the hospital. I want to show you a couple things. Right behind me, you see a hospital bed. It actually has 2 babies in the bed. They have to share the bed. They're just running out of space. It's not something we see back in America. And then look back here, there's a woman
the red shirt, the black polka dots, she's actually bagging her own child. They're so short-staffed that the mom has to sit there and pump, making sure her little baby gets air.
Family members will often take turns. Here, Grandpa sits while he squeezes life into his granddaughter. He told us he's been here for 2 weeks. Just across the hall, a baby clinging to life. The tips of her fingers are black. Her body is not getting enough oxygen. Her heart is failing. Little bodies fighting to hang on. This is why our doctors are here.
It's the people. We all want people. Doesn't matter where you come from.
Some of that will be over, some of that will be down.
Now, I know some of those images are hard to watch, but then you see pictures like this, Ruth after her surgery with a brand new smile. Now, the doctors and nurses were able to do more than 80 surgeries while in Honduras. Now, some of our viewers have asked, why do these doctors and nurses go so far away when there's people right here in the United States that need help? Well, I asked Dr. Alvear that question. Hear his answer tomorrow. For ABC 27 News, I'm Kendra Nichols.
From Honduras, you can see some of their
Dr. Alvear back in the U.S., operating at Harrisburg Hospital, fixing a little boy with a hernia.
I feel at home here. Quite different from the third world.
In Honduras, the rooms were small, equipment was outdated, and they were running out of room.
When you have 3 babies in one bed, or they're all close together, there are not enough nurses to take care of the sick babies or sick patients. And if you see the emergency room where the moms have to ventilate their babies.
Images like this don't exist here.
I think that we here in the United States are just extremely lucky to have all the resources that we have.
Here, rooms are filled with the best equipment. Even rubber gloves can be a luxury.
There are hospitals that don't have enough resources where they actually take the surgical gloves, they wash them, disinfect them, and repackage them so that they can utilize them for other surgeries, because the hospitals just can't afford to buy gloves, which we throw out here like, it's nothing.
Dr. Alvear making rounds, checking on his patients.
Just want to show you how good he looks, and he's ready to go home. Unlike there, they're still in pain and have all kinds of problems, and the usual they stay for 3 or 4 days or longer. But here, they can go home in about 12 hours.
In the recovery room, his hernia patient is already being comforted by his mother.
Made me nervous, but I know it'll be okay, so.
The recovery room here is quiet because here the patients get pain medicine, something they can't always afford in Honduras.
That would be awful.
That's why Dr. Alvear started the World Surgical Foundation. But why do they focus their attention outside the country? The same laws that protect us here in the U.S. can also get in the way.
Yes, there are state mandates and legislature that prohibit us from going to practice medicine in another state.
Just to give you an example, in Katrina, if you were a doctor and you tried to volunteer your services there, you can only mop the floor. You can't really take care of patients because if you try to take care of patients and you are from another state and you don't have a license in that state, you can be liable for anything. It's a shame.
Dr. Alvear will be 70 years old soon and is close to retiring. So what's next for the World Surgical Foundation and the people around the world that rely on their help?
And we don't know where we're going from here. And I'm hoping that many people will recognize what we do and then they'll continue on with the project.
We're making an impact on the world, and we need to have more of this.
Dr. Alvear also performs dozens of free surgeries right here in the U.S. every year. But he, along with the nurses and doctors that travel along with him, well, it's clear that they have a heart for those around the world. The next stop for the World Surgical Foundation, India. They will be leaving in January. For ABC 27 News, I'm Kendra Nichols.